Hi, I'm Deanna Salter, student nurse. I'm going to be demonstrating how to mix insulins. Okay, so we have the MPH insulin and we have the regular insulin. First, we're going to check our doctor's orders to make sure everything's right on the MAR. And then we're going to compare the insulins. Okay, we got the right insulin here and the right insulin here. So we're ready to go. So we're going in the patient's room. We're going to wash our hands and we're going to identify the patient, their name, date of birth, looking at the MAR, comparing the MAR to the patient's ID band. So then we're going to do a focus assessment. We're going to focus and see, we're actually going to check their sugar before. So you already have checked their sugar. You're going to make sure they're not hyper or hypoglycemic. You're going to make sure you see no sweating or, hyperactive, or if they're hungry. You're going to check their last injection site just to make sure everything's good. You're going to assess their skin and integrity. And we're going to find a new location right align the umbilical and find a new location for your insulin site. Okay, so now we're going to compare the insulins with the MAR, which we already did. We're going to check the expiration dates and we're going to roll the insulin. So we got rolling. So we're only going to use one syringe. So we have our syringe. So we're going to be giving 20 units, 10 units of MPH and 10 units of regular insulin, which will give us 20. So first we're going to open our insulins, and as you're opening them, you're going to wipe your tops with alcohol wipe. Okay, all right, so now I'm gonna draw up 20 units of air. So we're going to put in the cloudy, we're going to go ahead and put 10 because we need 10 of MPH without touching. Ten units of air. Awesome. Now we're going to go to the clear, put 10 units in of air. And now we're going to draw up 10 units of the clear. And then we're going to draw up 10 units of the cloudy for a total of 20. Awesome. So we have 20 units. Okay. If you're outside the room, you're going to label your tube, and we're just going to go ahead and recap it. So you're going to label your tube if you're outside the room so you can make sure that you have the right amount. Okay. So then when we go inside the room, we want to make sure before we go in, we're going to make sure we verify our amount of insulin, 20s, with a second nurse. And then she's going to put that in her charting, okay? And then we're going to do a third check at the bedside. We're going to explain this procedure to the patient. Mr. Witherspoon, we're going to be administrating you 20 units of insulin. We have 10 units of the MPH and 10 units of the regular insulin because your sugar was 254, and that's on your doctor's order. Are you okay with that today? All right, we're gonna do it in your stomach. Okay, is that all right? All right, then we make sure, again, before you start, just make sure you identify. Sir, what's your name and date of birth? All right, we have Mr. Witherspoon, 10/12/08 is his birthday. Okay, we're gonna clean the area with alcohol pad in a circular motion, and then we're going to pinch the area about 1 inch and insert the needle at a 45-degree angle. Okay, all right. We're going to insert it slowly, make sure we're not hurting them. We're not going to rub it afterwards. You can we're going to insert it and withdraw the needle. And then we could put a little alcohol pad right there to the side just to get a little bit of the bleeding, okay? Then we're going to put it in our safety safety deposit, our sharps needles box. Okay, and then we're going to remove our gloves. Then we're going to go wash our hands. And then before we leave, we're going to ask the patient, do you have any questions? How are you feeling right now? And let them know that we will be back to recheck on them and see how they're doing. And then you're going to document everything that you have done. Thank you.